This major shopping street in Kerala's Alappuzha district is unusually deserted for this time of year. The state is in the middle of Onam, its biggest festival and shopping season. BINDU KRISHNA is weaving a marigold garland used for Onam decoration. After months of closure, vendors like her were finally allowed to set up shop. But celebrations have been muted and demand has been slow because of rising COVID-19 infections across the state.
The government should decide. Sometimes they allow us to open, sometimes they want us to close. What will poor people like us do? If they ask us to shut shop after Onam, we'll be in great trouble.
Once praised for controlling the pandemic, Kerala has now become the COVID-19 hotspot in India. The local government has eased restrictions for the festival, and state police have been deployed to enforce mask mandates and prevent crowding. There are rules requiring shoppers to either get a negative PCR test or show proof of vaccination. But shopkeepers say these are hard to implement and are affecting business during peak season.
Business has become really difficult. Since the pandemic started, we have been forced to shut our shops. Even when the markets open, the police comes in and we have to request them to let us run our shop so we can make some money.
With a high number of infections, experts say Kerala and India's northeast are still in second wave of the pandemic, which could lead to a surge in other states. Roughly 9% of all Indians have been vaccinated across the country.
Unless we are seeing above 60% of the population vaccinated and preferably up to 80%, everywhere, we cannot really say that India is safe. Because if there are large pockets of unvaccinated population in different parts of India, the pandemic could actually flare up there or new variants could arise there.
But despite a high vaccination rate, Kerala's positivity rate is above 15%, prompting the central government to give more than $30 million to strengthen its health services. Pavni, Mittal, Jazeera, New Delhi.